am overseeing the Ohio program for campus safety and mental health at NeoMed. I'm joined with Dr. Perez, who I'll introduce in a moment, as well as Amy Lukes, who many of you know well. So happy that you all could join us. We know you're very busy. And we are planning to have webinars each month throughout the year. We will take a break for December. And I believe that you all have had information about the upcoming webinars. So again, we appreciate you joining us. So today we are very excited to have Dr. Roberto Perez, who's an Associate Vice President of Student Health and Wellbeing at the University of Alabama. He previously served as Director of the Counseling Center and Adjunct Assistant Professor in the School of Psychology at the Georgia Institute of Technology in Atlanta. And as Assistant Clinical Director, Assistant Clinical Professor in the Counseling Center at the University of Florida. He's a licensed psychologist in Georgia and Florida, earning degrees from Boston College, a BS and MA, and also a PhD in counseling psychology from the University of Missouri in Columbia. And he's going to share with us his experience with implementing, maybe experiments too, right? Experience with implementing zero suicide on a college/university campus.
Great, thank you very much, Russell and Amy. And I appreciate the opportunity to share the experience and some of the information and knowledge that that I have related to implementing a zero suicide initiative on a college campus. And you know, as we know, suicide continues to be a major concern across university and college campuses to date, and a number of mental health providers, administrators, staff, students alike, as well as families join in this concern. Zero suicide is an alternative approach, as I see, to suicide prevention that can be uniquely adapted to college campuses. And again, it's an aspirational approach and goal that really seeks to define a different way to consider suicide prevention and a different way to think about how to provide effective services and programs on college campuses related to suicide prevention. And so for the purposes of this presentation, I'll be talking about the implementation of a zero suicide initiative at Georgia Tech, where I was previously the counseling center director there. And then also to update you here at the University of Alabama, where I began my role just about a year ago. We're already in the process of starting to build a foundation to implement a zero suicide initiative. And so much of the information that I'll be presenting today will be a similar process that we'll be going through here at the University of Alabama. So what I wanted to do is just start off with an introduction, brief introduction to look at suicide and some of the information related to data on suicide nationally, suicides on campus, some of the information that we have there, as well as a brief look at, you know, what are some of the responses, resources, and initiatives that currently exist. So the rates of suicide continue to grow, and what we know is suicide is a national issue. It's a national problem. The increasing trend of suicide nationally has been well talked about, and the most recent information that we see here is almost 45,000 people in the United States die by suicide, and most of them, almost a quarter of them are white men. When we look at the total number of attempts during 2016, it's estimated that there are over 1 million attempts, and that perhaps a really shocking data point is that there are approximately 269 lost survivors. And so the impact of one death by suicide is tremendous, and collectively that impact is enormous. When we look at the data related to suicide and other causes of death, suicide still remains the 10th leading cause of death overall. And for the age group 15 to 24 years old, suicide remains number 2 cause of death, preceded by accidents and followed by homicides. In the United States, if we look at suicide rates by age, what we see is a continued and consistent rise in the rates of suicide across age groups. And again, particularly for ages 15 to 24, which is typically the age group that we consider for young adults, late adolescents, young adults, college age groups, that that increase is consistent and continues to be on the upswing. One of the most important, I think, pieces of information that is out there is from the Center for Collegiate Mental Health from Penn State. And the Center for Collegiate Mental Health at Penn State University is an aggregate, a collection of over 500 campuses across the country that share a common database and really look at the concerns and the issues that students presenting at counseling centers present with. So these are the concerns that students come to counseling with are really examined in a very comprehensive way by the Center for Collegiate Mental Health. And what we see here related to the presenting concerns or the questions that students are asked at counseling centers across the country is that we see an increase, again, a steady increase in the number of students who present at counseling centers who have seriously attempted or considered attempting suicide. An increase in the percentage of students who have attempted or considered attempting suicide just within the last month or sooner. And then an increase also in those students who have made a suicide attempt. And again, these are students presenting to counseling centers who are endorsing these items. And part of what we also know in collegiate mental health is that there are many more students on college campuses who don't seek out counseling, who don't seek out mental health services, and so who may also be experiencing suicidal thoughts, suicidal ideations, and certainly attempting, may have made a suicide attempt. So the numbers are staggering. The increase and the consistent rise in deaths by suicide, and certainly on college campuses, the number of students presenting to counseling who seriously consider suicide or make a suicide attempt is also just as alarming and just as serious. When we consider the various campus responses, various initiatives and resources available to college and university campuses to address suicide and to assess students in addressing these issues, I think we may all be familiar with some of these resources, the QPR Institute, the Question, Persuade, Refer, which I see as a gold standard in providing information, awareness, and knowledge for anyone who is interested and committed to suicide prevention. The JED Foundation, of course, has long been in the business of promoting suicide prevention and awareness programs, develop a very comprehensive approach related to strategic planning on campuses. And then certainly through the CDC, there are publications on suicide prevention, and the Higher Education Health Alliance, which is a collection of higher education organizations across the country, have also promulgated information related to suicide prevention. And then most notably, the Garrett Lee Smith Campus Suicide Prevention Grant by SAMHSA, I think has really allowed an increase in the number of services and programs dedicated to suicide prevention, particularly on college campuses. So while there are a number of these campus responses, initiatives, and resources, there's still more that can be done related to how a campus goes about understanding, conceptualizing, and really reframing the message of suicide prevention. What I'd like to do now is talk a little bit about zero suicide. So I'll start with a historical perspective and touch on zero suicide as an international initiative, its implementation in community health, and moving then towards implementation on the college campus. Zero suicide was really an international initiative, and this was established a few years ago, about 3 years ago in September, as part of the International Initiative for Mental Health and Leadership, which was convening in Atlanta. And I think that this meeting, this group really spearheaded a unique initiative and a unique challenge, and that is to imagining a world where suicide can be talked about openly, not stigmatized, where all people can empathize with individuals who are experiencing thoughts of suicide, where not one patient, where no one dies of suicide in any healthcare setting, and where the common goal of suicide prevention in healthcare and in addiction care is shared by everyone. There's also a shared commitment to augmenting and enhancing the interventions within all healthcare systems, and that as a collective, all workers within a healthcare setting are committed to zero suicide, or reducing the risk of suicide to zero. What I want to say is also that again, that I think this represents a very unique approach and conceptualization of how suicide prevention can be approached. I think that where some of the challenges for counseling centers or college mental health centers particularly is in reconceptualizing approaches to suicide prevention, and I'll get to that. I'll speak to that in a few minutes. So I put this up because when I was at Georgia Tech, this was really the seed that started me thinking, started my staff thinking about the Zero Suicide Initiative, and it was based on an NPR story that I don't know how many of you listen to NPR, but it was a story that piqued my interest just as I was pulling into a parking space at the grocery store. But it was one of those stories that I was hooked on because the headline was, "What happens if you try to prevent every single suicide?" And it touched me because at Georgia Tech we were coming off of a recent suicide of a student on campus, and so it was particularly salient at that moment. And so the story really was my first introduction to the Zero Suicide Initiative and concepts. And I think one of the things that struck me particularly in the story was what you see on the screen there in terms of how the staff at the Henry Ford Clinic in Michigan initially thought about their suicide prevention efforts. And again, you'll see that part of the quote is, traditionally they had always addressed suicide as something that was inevitable. So they knew what on the average their center would experience in terms of deaths by suicide. And likewise at our center at Georgia Tech, we knew that on the average our campus experienced one death by suicide a year of a student, whether that's off or on campus. And so the challenge was how to reconceptualize our thinking about our suicide prevention, where our goal was not so much to not exceed our average of student deaths by suicide, but really to reform it and reshape our conceptualization of suicide prevention to reflect a zero suicide notion, that is eliminating suicides and reducing the number of suicides to zero. When we look at other campuses around the country, and certainly when we implemented this at Georgia Tech, there were very few campuses to date that were implementing a comprehensive zero suicide model based on the foundations of the zero suicide approach. And what we found is that there were some campuses that were implementing select elements of the zero suicide initiative, but not entirely. And not all campuses were engaging the entire campus community, but only engaging parts or certain departments within the university. And so our challenge was how to take the principles of zero suicide and think about what that could be on a college campus. And as we were doing that, the Georgia Department of Behavioral Health was also in a similar track to implement the zero suicide initiative within their community agencies. And so we were able to partner with the Georgia Department of Behavioral Health to implement a zero suicide initiative, not just at Georgia Tech, but to consider it for all the universities and colleges within the University of Georgia system. But historically, those are some of the tenets, some of the information related to zero suicide. And I want to then move to the philosophy of zero suicide, talk about maybe what it is and what it isn't, and also look at the 7 core principles as well. So I think these quotes are pretty illustrative of what zero suicide is. And it's a commitment to suicide prevention that also includes a specific set of tools and strategies. It's a concept and a practice. And that the challenge and implementation of zero suicide can't be borne just on practitioners alone, but is a shared responsibility by everyone. And that's everyone within a community center or a college setting, a college campus setting. And I guess what, and so there have been some misunderstandings or some misconceptions, I think, of talking about a zero suicide initiative, particularly as it would be implemented on a college campus setting. And again, these are discussions that I had with my staff in terms of educating them so that they had a better understanding and a more accurate perception of the initiative. So again, across the years, the college campuses and college counseling centers have really had several initiatives in place and efforts in place in an attempt to reduce suicide and suicide attempts. And early attempts on suicide programming has focused on prevention and looking at not only how to reduce suicide, but in some cases, a zero tolerance perspective. And zero suicide is not a zero tolerance approach to suicide prevention and doesn't claim to be a panacea for eradicating instances of suicide, but rather zero suicide attempts to be aspirational in its approach. It aspires to create an extensive and really comprehensive system of care to identify individuals at risk for suicide and provide effective services, intervention programming to significantly reduce deaths by suicide. And so, again, my staff in my initial conversation and meetings with them were concerned that some of the consequences would have some negative outcomes, particularly if there was a death by suicide and we implemented this program. And again, I talked to my staff and they all came to an understanding and a better appreciation of the zero suicide initiative, and that it's very aspirational in nature, and that it really emphasizes the notion that that there's no tolerable number really for to settle on in terms of student deaths by suicide. And so we really should be striving to eliminate suicide, to have those numbers to zero. What I'd like to do is just touch on the 7 core principles of zero suicide. And again, this comes from the original Zero Suicide Initiative. And there are 7 core principles: lead, train, identify, engage, treat, transition, and improve. And each of those core principles really work together to serve as a foundation for the initiative. So lead really talks about giving leadership, creating a team of folks within an organization to representing key functional areas, which also includes representation by loss survivors. Training reflects the training of all staff, both clinical and non-clinical staff, to respond effectively to any risk of suicide and provide effective suicide prevention. Identify includes effective screening and assessment of new clients or existing clients for suicidal ideation. Engage and treat reflect making a commitment to following every client who is at risk for suicide, and then also engaging in evidence-based treatments that focus specifically on effective treatment of suicide risk. And then lastly, transition is about putting policies into action that reflect effective programming that also include effective evaluation and assessment efforts in improving the program and being informed by data. So with that, I'd like to move to implementation on a college campus. And here I'll talk more about sort of specifically how our counseling center, Georgia Tech, implemented the Zero Suicide Initiative and get into some of the details there. So in this section, I'll talk about main points to consider, provide an overview of our Tech End Suicide Together initiative, how we adapted the 7 core principles for use on a college campus, and then the levels of prevention, which for us was something that we incorporated as part of our Zero Suicide Initiative and felt that it was important to include as part of our program. So I think some of the main points to consider first is when thinking about implementing a Zero Suicide Initiative on a college campus is who is going to be the lead group or the lead department. And certainly in our case, the counseling center took the lead in being the expert group to train others, to meet with others, to really bring this initiative to campus. And so in talking with our vice president of student life, we were able to get some great buy-in. But I think what's important is who on your campus is going to be identified as a lead department or group. Then I think it's also important to consider adapting these core components to a university setting. If any of you have taken a look at some of those original 7 core components, you'll see that the language really is designed for community mental health agencies. And so in looking at the language and its application to a college counseling center or college mental health agency, the wording and the language doesn't quite make a lot of sense, doesn't quite fit. And so I think it's important to look at adapting those core components and the use of that language within a college campus setting so that the language is widely known by everyone. The other thing is creating buy-in and developing relationships across campus. And again, this goes to the point that suicide prevention on a college campus is everyone's business and is everyone's role. So regardless of whether you're faculty, staff, or student, that everyone's engaged in the safety and well-being of all the campus members, and everyone is engaged in preventing suicide. The last couple of points go to identifying resources, the importance of messaging and marketing avenues for your particular campus, and also the consideration of future deaths as they occur. How does the campus respond to that, and what is the message that goes out? This is just a timeline, just to give everyone kind of a context of the process that we engaged in at Tech to implement this on campus. And so you'll see it doesn't happen overnight. It's a series of steps, and it's a process that we hope was certainly well thought out and very intentional in not only planning its implementation, but answering the question of who needs to be involved, who of our campus collaborators would really be critical in at least helping us to initiate this program, this concept, and pulling everybody together so that everybody's on the same page. And so you'll see where we start our discussions mid to late fall semester of 2015, and we move forward with the bringing folks together, working with upper administration, and really then expanding efforts towards the fall of 2017 and then beyond. One of the things I'd like to talk about is in implementing this initiative is the oversight team, the implementation team, and the lead ambassador. And our implementation team were representatives from across campus, and I'll have a slide about this later on. But the role of that team was really to help get us started to think about how does suicide prevention affect the campus and each of our partners, and what role do each of our campus partners have in that effort. And so the implementation team was established to serve as the leadership team for this initiative that was representative of the entire campus community and who were engaged with student health and well-being. The oversight team was then also established to serve as a smaller group who would have eventual oversight of the initiative and coordinate programming, coordinate messaging across the campus, and it's really meant to serve as the point of contact for the initiative moving forward. And then lastly, what we found at Tech is that, and I'd encourage campuses to also think about this, is a lead ambassador, someone with campus stature, visibility, someone with an ease of relationships, both with faculty, staff, and students. But we found that having a lead ambassador really helps to promote our message of zero suicide, and really helps to personalize the message. And so for us, having a lead ambassador was really critical. And our lead ambassador was Ms. Val Peterson, who's the First Lady of Georgia Tech, President Peterson's wife. The other thing we developed were two resources. One was a toolkit, again, and it's a collection of resources both on and off campuses, both off and on our campus, that listed information related to counseling, suicide prevention, programming, events, our QPR training, and all these different resources, both on and off campuses, that faculty, staff, and students could access to get more information and more training. The other thing that we developed was this thing called our blueprint. And the blueprint represented the scope of existing programs and services that reflected, at some level, suicide prevention efforts. And so it was intended to really reflect what we were currently doing, but also provide a rubric for us moving forward in developing future programming and future initiatives for zero suicide. So earlier I talked about our implementation team members. This is an overview of our representatives, and as you'll see, it really represented a very broad sweep of not only campus representatives, but also areas and departments within which we at the Counseling Center had relationships with or had collaborated with or partnered with. So these really represent for us our campus partners. And so we were very fortunate to have an established outreach to a number of campus partners and departments, ranging from admissions to student government, upper administration, fraternity organizations, as well as our human resources and external groups such as campus ministries. And again, I think that part of the beauty of this initiative is that it provides an opportunity to not only build on existing partnerships and collaborations, but to expand those partnerships and possibilities for collaboration. Breaks down silos and brings everybody together on the same team. When we looked at adapting the 7 core principles of tech, it was really, again, important for us to look at each of these 7 principles and to consider how they can be revised so that the language could be understood within a higher education setting, and it was also relatable to everyone. And so you'll see here these 7 core principles, the same ones that are listed, or part of the initial Zero Suicide Initiative, but now I'll go into how we've adapted them. So the first one's lead, train, and identify. You'll see here are the adapted principles that we initiated at Georgia Tech. And again, for lead, it's the establishment of this leadership group or implementation team that's representative of the entire campus community. And for us, it was important to, again, include both survivors and those with lived experiences. For train, we reframed it so that we included the focus on college mental health professionals as the experts on campus to provide the training and facilitate the training of additional campus members. And then identify, we talked about how a network of care is important to establish, in which all members of the campus work to identify those at risk for suicide, and all campus members have knowledge of suicide prevention efforts and ways to intervene appropriately. And the last 4 elements are core principles of engage, treat, transition, and improve. The way in which we reconceptualized and adapted engage is developing not only effective plans for involving each campus unit, but also the role of a counseling center to assist in that consultation and the development of another department or unit's plan for suicide prevention. Treat, we pretty much kept intact in terms of acknowledging the effective use of evidence-based treatments that are related to reducing the risk factors associated with suicide, enhancing protective factors. And for both transition and improve, we focused on not only that care for the individual at risk be continuous and ongoing, but campus units really should develop effective guidelines and processes to continue and to maintain extended care as necessary. Whether that be from the counseling center's perspective, whether that be frequent follow-up counseling sessions or referrals for maybe intensive outpatient care, or whether that be residence life plan for a series of wellness checks and checking in or engaging at-risk individuals. And also improve, again, the importance of program evaluation and assessment to look at the impact of the initiative and to help inform future areas of improvement. As part of our initiative, we also included levels of prevention as a way to help our campus partners realize that their activities are seen as not only critical to student life, but can also be seen as ways of suicide prevention, particularly in the primary prevention area. And so one of the ways we reconceptualize or help talk about these levels of prevention for our campus partners is, for example, in housing and residence life, that the number of programs and social events that they routinely host for their residents is really a primary prevention effort, because it reduces the risk of isolation and engages students who might otherwise be isolated. In terms of our campus facilities partners, we talk to them about ways in which they may already be reducing access to means of suicide by installing railings or breakaway shower curtains in the residence halls, or other types of efforts, keeping a locked door or preventing access to areas on campus that could potentially be seen as a means for suicide. So again, I think it was for us important to not only adapt those 7 levels, but 7 areas of the core principles, but also to introduce these levels of prevention so that everyone on our campus and our campus partners could relate to and see, oh, I have a part of this, that our department really is doing something to contribute to suicide prevention on campus. The other 4 areas I want to also touch on is strategic planning, communication marketing, identifying program resources, and also engaging external constituents. I think that, again, the adapting the principles of zero suicide and having everyone, campus collaborators and partners, be engaged in that process is important. And just as important is how the message of zero suicide is promulgated across the campus, and how that message is established and developed. I know for us at Georgia Tech that we wanted to have a message and have this initiative be something that reflected both the culture and the students at Georgia Tech. Now, Georgia Tech is a very highly competitive institution. Its students, as in other highly competitive institutions, are themselves highly competitive, and with that competition brings an inordinate amount of stress and expectation. And so we wanted to have a message that resonated with students and the entire campus community. And that was part of our communications and marketing plan and our strategic planning as well. So in terms of campus engagement, a couple of points here. For us, we needed broad engagement of faculty, staff, and students. And what you'll see on the side are different post-it notes that were part of an exercise that we engaged with a number of our groups as a way for them to provide feedback, and as a way for them to own their investment in the initiative. We also utilized different platforms of social media, developed a consistent message, and we also wanted to engage parent and families too, because as important as our campus partners are, our parent and families are important external campus partners, because they can certainly convey the message, be consistent in our message of suicide prevention, zero suicide, but then also we can provide them with the awareness, knowledge, and skills needed to intervene as needed. And then lastly, we felt it was important to embed our message of zero suicide within a broader culture, within the broader campus message of well-being for all students. In creating different cross-campus collaborations, as I mentioned before, it's important to not only engage those campus partners that already exist, but also to establish new ones with new relationships with other partners and other departments. And what that does is it allows for greater buy-in from campus stakeholders. And also what we found for us is that it was helpful in leveraging, being able to leverage their influence to help advance our program initiative and help to also garner external support as needed. On the diagram or the picture here, it just lists some of the different QPR instructors that we were initially able to expand to across the campus. And certainly our goal, our aspirational goal in all of this as well, was to have everyone on campus be QPR trained. And so as part of that effort, what we were moving towards was a sense of having embedded QPR trainers within faculty, staff, areas, having students involved and trained as QPR trainers, to be able to then do gatekeeper training, provide gatekeeper training to other faculty, staff, and students. And here you'll see a list of names of current QPR instructors that we were able to engage and sponsor for QPR training, and that the areas that they represent. So areas not just from the Counseling Center, but from Office of Graduate Studies, our university athletics, housing and residence life, to faculty and staff areas. The other part of our communication and marketing plan was to develop a website. And again, for us, this was in collaboration with our marketing and communications department to establish this resource website. And you can see the website address there is endsuicide.gotech.edu. And here it allowed us to present our message and our title of the initiative, Tech and Suicide Together. And that title, again, reflected not only the notion of zero suicide by ending suicide together, but it was a notion of collaboration among all faculty and staff at Georgia Tech to work aspirationally to reduce the number of suicide to zero on campus. And so it brought together, and I think really helped to, as a cohesive element for faculty, staff, and students to have a common goal, have a common message that could then be embedded in a broader campus message of student health and well-being. So if you go to that website, endsuicide.gotech.edu, you'll find more information about the campus initiative. You'll also see a series of videos that were produced to also promote not only the Tech and Suicide Together initiative, but also to provide training information on suicide prevention and intervention. As part of our communication and marketing materials, we established both a promotional flyer and an informational flyer. The promotional flyer focused more on the Tech and Suicide Together initiative, again, and talked about its roots in the Zero Suicide Initiative. And then our informational flyer talked about or provided information related to warning signs, where to get resources, and how to help others if they're at risk for suicide. In terms of social media, we engaged in a social media campaign, buttons, stickers, and you'll see this an image of our sticker, Tech and Suicide Together. And these are just photos of different student groups, different groups on campus, individuals and offices that were taken from, I think this was our Twitter campaign, #JacketsEndingSuicide. But really, it was a way to not only kickstart, but to maintain the initiative throughout the year and to maintain the campus awareness of the suicide throughout the year. One of the things that is also critical is the need to identify by program resources. So as I said previously, the responsibility for suicide prevention can't solely be borne on any one department. It needs to be a shared responsibility. And likewise, I think resources can't be borne by any one single department, but has to be a shared responsibility. And so for us at Tech, we needed to clearly define where the money, where the resources were that could help support development of videos, training materials. Each department contributed what they could in terms of, again, programming efforts, resources to support those programming efforts. And then also for us, there are campus-based funding opportunities, such as the Alumni Association or our Student Alumni Association, Parents Fund, that really could serve to provide resources and support in these areas. So the last couple of things I want to sort of quickly go over is establishing these teams, creating a blueprint for zero suicide. And again, as I mentioned before, the implementation team is important, and that it needs to be representative of the entire campus. Again, that creates buy-in and really helps to tear down sort of these silos that can occur on college campuses. This blueprint, again, so this is something that was established, and as you'll see, if you can see on your screens, this samples of the blueprint that allows for how each area can contribute or is contributing to zero suicide or to our Tech and Suicide Initiative through their programs that already exist, either as primary, secondary, or tertiary interventions. And so for us, it provided a roadmap of not only where the programs were, but moving forward where we needed to fill in the gaps. And then lastly, establishing an oversight team, again, is also important to continue the initiative. And again, I believe that it's important to include members of that oversight team who have lived experience or are law survivors. And it's really this team that continues the initiative and has, as its name implies, oversight over the promulgation of the materials and the efforts. And then lastly, talking about an assessment plan, which includes a unit self-study and a progress worksheet. When we looked at the original zero suicide assessment plan, we thought it important that we also include an assessment plan for college campuses and for our initiative. And again, we needed to look at how we translated those original assessment plans for use in a college setting. And so there are two documents which specifically we looked at, and that was the organizational self-study, which we renamed the unit self-study, and the work plan template, which we renamed the progress worksheet. And so for us, we developed this self-study as a way for departments or each campus unit to define, evaluate which areas of a zero suicide initiative are in place, the degree of implementation, and how to identify future services. And it can also be used as a baseline for a department to identify components of the initiative and assess ongoing implementation. And this is just a sample of that unit self-study. The full form is available on the endsuicide.godtech.edu website. But here you see we've developed a Likert scale, and we've paralleled the unit self-study so it's reflective of each of the 7 core components. So this one is in lead, and you'll see how we've, if you go back to the original assessment documents and compare it to ours, you'll see our attempts to try to adapt that language for use in a college setting. And then the other document is the progress worksheet, which various departments or units could use to track its progress in implementing the initiative and opportunities for continued development. And again, a sample of this worksheet is presented here. You can download the full document from the website, but here it has different critical tasks for each of the 7 core components, the progress for the department, who's responsible for implementing those, that progress, and then status of each task. So lastly, lessons learned from this initiative. And then I guess with the time left, we can open it up to discussions. So for us, the lessons learned was that, suicide and other deaths still occur. So I think it's important to realize the aspirational nature of zero suicide or this initiative on college campus, and that it's how do you present that message of suicide prevention within the context of zero suicide. And so for us, what was actually unique is that there was a death by suicide during the fall semester of this launch. And it really galvanized the campus to invest more in their knowledge. And so rather than having an adverse effect, it really galvanized the campus to become more engaged and invested. And so I think that also goes to the second point of inviting staff in the campus to engage in training and discussion related to suicide. Again, it's helpful to have someone who is a lead ambassador for your program, who can be the forward face of this initiative to faculty, staff, and students. Also, it's important to know how to explain the importance of this initiative to your campus community. So you'll need to know the messages that are important, the words and the message that will resonate among faculty, staff, and students, and then that allows greater and more broader campus buy-in, which again I think is necessary and important. And then lastly, how's success defined? What does it look like for your campus? And I guess I would state that success may not necessarily be defined solely by the number or the decrease in the average number of deaths by suicide, but also can be measured and assessed by the number of folks on campus who are QPR trained, the number of departments that are making progress in each of those areas, each of their areas for implementation of a zero suicide initiative. And lastly, have a sustainable plan. Staff leave, there are changes in administration, and there may be shifting divisional and university or institutional goals. So I think having a sustained plan is important, certainly having an oversight team in place that can overlook or maintain the sustainability of an initiative like this is also important. And so again, I hope that this has provided some broad knowledge and a good overview of this initiative.
That's great. Thank you so much. I don't want to keep people any longer. Dr. Perez, really appreciate your insight and your experience that you shared with us. And again, I thought it was like really rich details in terms of how to implement and certainly how you did it at Georgia Tech. And good luck to you at Alabama. Thank you all, those of you who have participated, and we hope to see you next month.